So good morning. Today I'm going to present on topic coal. So before start my topic, I will start with a saying that man in coal is not necessarily a coal man. So it's by the David Best, Yale University physiologist. So the first thing I'm going to talk is about coal stress. So what is coal stress? So coal stress is environmental condition whereby causing the loss of body heat that will threatens the homeostasis lah. So there's two major cold environment we can see here. So one is the air, another one is water lah. So the three physiology mechanism in avoiding this excessive heat loss is, first one is peripheral vasoconstriction, second one is non-shivering thermogenesis and shivering. So the first one, the peripheral vasoconstriction, how it contributes. So basically by sympathetic stimulation of smooth muscle layers of the arteries in skin, and it will cause the vascular smooth muscle to contract, and whereby it will constrict the arteries, and hence it will reduce the blood flow to the shell of the body and minimize the heat loss. And the second one is non-shivering thermogenesis. So there is shivering thermogenesis and non-shivering thermogenesis. So here we will talk about the epinephrine, release of the epinephrine and norepinephrine lah. If we talk about non-shivering thermogenesis, it's a response towards cold exposure actually lah, with the release of epinephrine and norepinephrine. So there's a shivering thermogenesis, vice versa lah. So stimulation of metabolism by sympathetic nervous system increase, and hence increase the metabolic rate and hence increase the heat production. So the next one is the shivering, how it contributes lah. So rapid involuntary cycle of contraction and relaxation of skeletal muscle will increase 4 to 5 fold of body rate of heat production lah. So this is the shivering part. So next I'm going to talk about habituation and acclimatation. So both things, habituation is familiarized to the cold environment. If we see acclimatization is like about acclimation is about accustomed to that weather actually. So habituation is like those regularly exposed to the repeated cold environment. So in this scenario, the body heat loss will be no body heat loss, and there will be blunted skin vasoconstrictor and also shivering responses lah. So for them is like 30, if let's say cold is considered as about 32 degrees, for them is still it's cold is still they will be numb to 32 degrees, so they will be getting adapted to it. So that's what we call it as habituation acclimation lah. So acclimation, there's two actually lah. So metabolic and insulative. So if the metabolic one enhance non-shivering and shivering thermogenesis, and the second one, if the metabolic acclimation is not working, so then we proceed to the insulative. So enhance skin vasoconstriction, which will increases the peripheral insulation. So then the next one, this is actually a graph actually. So to tell that how they will maintain this core temperature. So our core temperature is 37 degrees and 98.6 Fahrenheit. So the most important organ that controls all this is our hypothalamus. So pre-optic anterior hypothalamus lah. So this part, if you see, this is the x-axis is skin temperature, and the y-axis here, there's two here actually. So if you see, the first one is heat production and the second one is core temperature. Why I'm explaining this is because how they can maintain this core temperature, the 37 degrees. So first, if let's say if you see this is thermoneutral zone, okay. So there's a metabolic regulation, vascular regulation, sweating. So if let's say if you see in order for the body to get 37 degrees, so if let's say they are in 30 or 20 degrees or below 30 degrees, so they will go through this process of shivering non-shivering thermogenesis. So in order to get the 37 degrees. So, and let's say if it's not achieve this maximal vasoconstriction, so they will back to the shivering and non-shivering thermogenesis. So this is how it works actually lah. So there is this is the core temperature. Okay, you can see here the graph. Okay, so this one. Okay, the next one I talk about factors affecting body heat loss. So what are the factors actually? The first one is body size and composition lah. How it works is basically thermal conductivity of fat. So what is that? Actually is a capacity of transferring heat actually lah. So it will be reduced. So that will make heat transfer from the deep tissue to body surface to reduce as well. So this will cause bigger people will conserve more heat actually lah because of the fat. So the good indicator for the individual tolerance for cold exposure is the skin fold measurement of the subcutaneous fat thickness. So larger individual with small surface area to mass ratio will have less susceptible to the hypothermia. So if you see children, they have a bigger surface area to mass ratio, so they will be susceptible to the hypothermia lah. So I will just talk a little bit about the wind chill. So what is wind chill? So it's about index based on the cooling effect of the wind. So if as the wind chill is increased, so the risk of freezing of the tissue be increased. There's actually a graph to explain on this lah. But I'm not going to touch on this further. So the heat loss in cold water. So if you see heat loss in air is basically by radiation and evaporation. So if heat loss in water is by convection lah. So the note that we have to take is that body loses heat 4 times faster in water than in air of the same temperature. So if constant internal temperature when remain inactive in water is about 32 degrees Celsius lah, which is equivalent to 89.6 Fahrenheit. So if let's say the water temperature reduced further than this, so then we'll have because of due to prolonged exposure to cold water or large loss of heat from the body immersed in cold water, so it will cause extreme hypothermia and lastly it cause death lah. So the next thing is if the water temperature lowered to 4 degrees, which is about 39.2 Fahrenheit, so the rectal temperature will also decrease at rate of 3.2, which is 5.8 Fahrenheit per hour. So it's just for general knowledge actually lah. So however, if let's say in athletes, exercise in water will increase the metabolic rate and offset some of heat loss lah. This is for heat athletes actually lah. So we're going to talk about the physiological responses to the exercise in cold. So the first thing is muscle function. So muscle cooling in cold exposure. So contraction with less force. Why? So this is because of the nervous system responding to the muscle cooling. It responds by altering the normal muscle fiber recruitment pattern for the force development lah. So that is how, why and everything. So in this case, how the athletes cope, basically by clothing insulation and also exercise metabolism. The next one I will talk is about metabolic responses lah. So basically prolonged exercise will have more free fatty acids oxidized and also mobilized. So that is as our fuel source actually. So primary stimulus for this increased lipid metabolism is the release of catecholamines, so which is the epinephrine and norepinephrine. So exposure to this cold will increase this epinephrine and norepinephrine, but the FFA, the free fatty acid, will be lesser compared during the prolonged exercise in warmer conditions. So in this scenario, cold exposure will cause vasoconstriction in vessels and also fatty subcutaneous tissues. So as the subcutaneous fat is the major storage site for the lipids, vasoconstriction will reduce the blood flow to the important areas, so from which the free fatty acid mobilize lah. So free fatty acid does not reduce as elevated level of the epinephrine or norepinephrine. So this one is just some said blood glucose plays important role in both cold tolerance and exercise endurance, and there was telling that this example hypoglycemia suppresses this shivering, but the reason still unknown about it lah. And the next one is blood glucose maintained well in cold exposure. So this one is muscle glycogen used in higher rate in cold compared to the warmer conditions. So that's why it's maintained. So effects of cold environment on cardiovascular and respiratory systems lah. So the first thing will happen is vasoconstriction, fluid shifts. The next one leads to cold diuresis. So when cold diuresis happens, increased fluid loss from the respiration or sweat during the exercise, and then it will cause reduced total circulating volume. So hence it will cause myocardial depression when there's a reduced total circulating volume, and it also could produce impaired electrical conductance, and hence will reduce cardiac output. So then when you can see a J wave in ECGs, if you do, you can see J wave and the ST segment lah. So okay, so in respiration wise, decrease in core temperature will reduce in airway protective mechanism, which will cause high risk of the expiration. So I will talk a little bit about hypothermia. So hypothermia is when the deep body temperature falls below 35 degrees. So what are the risk factors? The first one is cold air and the water temperature, and the second one is the air and the water movement, and the third one is age. Usually children and small adults will cold faster. As I said, there's a largest surface area ratio, and body stature, usually tall and thin will have cool faster than the short and stocky people. Body morphology wise, we can see if person with body fat, a lot of body fat, then yeah, gender, female tend to have more subcutaneous fat. And fitness wise, if increased fitness will increase heat production, fatigue. Then the next one is intoxication, and also lack of appropriate clothing. So the clinical features, there's 3 actually. I classified and I divided into mild, moderate and severe. So if we see mild one is 32 to 35 degrees, and this is the symptoms you can have: cold extremity, shivering, tachycardia, tachypneic, urinary urgency, and yeah, mild incoordination. The moderate one is the ranging is 28 to 31. So you can have apathy, poor judgment, reduced shivering. It can have weakness, drowsiness, slurred speech, amnesia, dehydration, and decreased coordination and clumsiness and fatigue. If severe, less than 28 degrees, so you will have inappropriate behavior, total loss of shivering, cardiac arrhythmias, pulmonary edemas, hypotension, bradycardia, reduced level of consciousness, and muscle rigidity. So management wise, I just talk about if let's say it happens that outside the hospital, what we can do: lay flat, give first aid, and inquire on the coexisting illness. Okay, then cover with blanket or sleeping bags, cover head, and leave airway clear actually. So and then insulate from ground, and then provide shelter from the wind and rain, and monitor vital signs, and ask for help and transfer immediately to hospital. So the prevention wise, right, the first thing is clothing with ventilation during work. So avoid the sweat accumulation, and you can use insulated garments, and seeking shelter during rest, and also regular hot meals lah. That's all.